Now we begins with the blood transfusion. So first of all, indications of blood transfusion: blood loss, severe anemia, erythroblastosis fetalis, where we have to do the exchange transfusion, blood disease, for example hemophilia, leukemia, acute poisoning, for example carbon monoxide poisoning. So these all are the indications of blood transfusion where there is a need to transfuse the blood to the patient. Now the precautions. Which type of precautions we must need to take before we transfuse blood to the patient? First one, healthy donor of 18 to 16 years of the age, no blood transmitted disease like AIDS, hepatitis, normal hemoglobin and PCV value. PCV means packed cell volume. Cross matching must be done. There is a two type of cross matching we have to do. First one is the major cross matching and second one is the minor cross matching. This major cross matching is also known as direct cross matching, and minor cross matching is also known as indirect cross matching. So in the major cross matching we have to match the donor cells with the recipient plasma, and in the minor cross matching we have to match the donor's plasma with the recipient's cells. Next one is the preservation of blood must be proper in blood bank. Aseptic measures must be taken, and post transfusion observations of the patient is necessary. Hazards of mismatched blood transfusion: agglutination reactions, hemolysis, hemolytic jaundice, and there will be the decreased oxygen carrying capacity of the blood, hemoglobinuria. In this condition of the mismatched blood transfusion, there is excessive damage of the RBC occurs and RBC breakdown. There will be the increase in the free hemoglobin level into the blood, and whenever there is a increase in the free hemoglobin level into the blood and whenever it is filtered by the kidney, this condition is known as hemoglobinuria, where there is a presence of hemoglobin into the urine. Next one is the transmission of blood-borne infections, for example AIDS, which is acquired immunodeficiency syndrome, pyrogenic reactions, circulatory failure, kidney failure or renal shutdown. Whenever this free hemoglobin which is passing through the kidney, it going to damage the structure of the kidney, and due to this there is a kidney failure or acute renal failure is the consequences of this hemoglobinuria as well as hemoglobinemia. Hemoglobinemia is a condition in which there is a increase in the free hemoglobin level into the blood, and whenever this hemoglobin is filtered by the kidney and highly present in the urine, then this condition is hemoglobinuria. And due to this, whenever this free hemoglobin passing through the kidney, it going to damage the structures of the kidney. So the kidney failure is one of the serious complications of this mismatched blood transfusion. These antigens plus antibody releases toxic substances which causes renal vasoconstriction, circulatory shock where there is a decrease in the blood pressure and urine output. Hemoglobin blocks the renal tubules. There will be the conditions of uremia and anuria. And death is the obvious condition in the mismatched blood transfusion. Autologous blood transfusion. Here in this condition, donor and recipient both are the same person. So the first one is the elective surgery. Now if the surgical procedure is pre-planned or elective surgery, in this condition a blood of the same person is collected before a month or 15 days of the surgical procedure, and the same blood is stored and later it transfused during the surgical procedure or after the surgical procedure to the same person. So this type of blood transfusion is known as autologous blood transfusion, where the donor and recipient is the same person. Recycling of blood from wounds during the surgery. During the surgery, whatever the bleeding occurs, they are going to collect the blood and again transfuse this the same blood to the same person. Sports person for better performance during the major sports. Now the storage of blood. We must need to take the aseptic measures. Acid citrate dextrose is added to the solution which can be stored up to 21 days. RBCs may swell up which is due to the loss of potassium ion and more sodium ion with the water. WBCs and platelets do not survive after 24 hours. So in this condition, if we need to transfuse the WBCs and platelets, then we must have to go for the fresh transfusion of the blood. So 80% of the RBC which survive after 24 hours, and after that 1% RBC loss per day occurs. So these are the blood types, and one most important thing I would like to tell you that here the O negative blood group, the person who having the O negative blood group can give blood to everyone. So these are the universal donor, and the person who is the AB positive blood group can receive blood from everyone. So these are the universal recipient. So AB positive blood is the universal recipient and O negative blood is the universal donor. But this is only theoretical aspect, and before we go for any type of blood transfusion, we must need to do the cross matching. Whenever someone asks you who is the universal recipient, then you have to tell AB positive blood group, and who is universal donor, then you have to tell O negative blood group. So here what I said, universal donor is the O negative blood group and universal recipient is the AB positive blood group, but it's only theoretically possible. So this is the recipient's blood which having a type A antigens on the red blood cell and antibody B which is present in the recipient blood. And whenever this donor's blood which enter into the recipient circulation which having the donated red blood cells with B antigen, now here what will happen, this recipient which having the antibody B going to attack the cells of the donor. Now there is a damage to the RBC and RBC breakdown takes place into the circulation, and due to this RBC breakdown the hemoglobin is released and there is a presence of free hemoglobin into the broad circulation. This condition is known as hemoglobinemia, and whenever this free hemoglobin passing through the kidney and present into the urine, this condition is known as hemoglobinuria. And now whenever this free hemoglobin passing through the kidney is going to damage the structure of the kidney, and due to this there is a acute renal failure which is a serious complications of this mismatched blood transfusion. Now the main symptoms of acute hemolytic reaction. I told you what is symptoms and what is signs. Symptoms means whatever the patient tells to the doctor, and sign means whatever the doctor which observes into the patient. Systemic symptoms, chills and fever. Vascular symptoms, hypotension and uncontrollable bleeding. There will be the heat sensation over the transfused veins, and there is a pain in the lumbar region. There is a increase in the heart rate, constricting pain in the chest, and the urinary system involvement which having the hemoglobinuria, and the second one is the hyperbilirubinemia. So these all are the main symptoms of acute hemolytic reaction, and whenever the recipient complains about these symptoms, we immediately stop the blood transfusion. I hope everyone understood about the different type of blood elements from the beginning of chapter 1 to end of this chapter. If you like my videos, then please press the like button as well as share with your groups, and please do not forget to subscribe to my channel, and thanks a lot for 1000 subscribers. And here is my quote: with education you will achieve your dream life, but to to influence others to dream about your life, it is imperative to utilize yourselves to the maximum level. Please remember,